Well, good afternoon, everyone, and thank you so much for joining us today for the State of the College address. Really appreciate everybody taking time to be here. There's a big party going on outside, so I was afraid I might lose most of you to that big party. But we're patient, family-centered care people, so we're happy that they're able to celebrate as well. As you can see from the title of my presentation today, I'm going to focus a little bit more on what we've been doing in the last 10 years, particularly in impacting oral health throughout the state, the nation, and even the world, as you can see in a little bit. And we've done that through an incredible amount of volunteerism, service, and outreach. So these are the things that we're going to cover today. And then, but I do want to look back a little bit on some other areas too, because I can't be here today without recognizing all the people who have been so integral to the success of this dental school. And first of all, I'd like to recognize Dr. Gretchen Kaufman. Gretchen, our Executive Vice President and Provost. And our Dean, Lucy Marion, from the School of Nursing. Mark Hamrick and Kent Guyan, both Vice Presidents at the university. Nice to have you here. And before we go much further, let me just recognize all of the dental faculty and staff that are here today. And would you please stand and let's give ourselves a little, a little applause. Thank you so much. So I'm going to go look back a little bit because, interestingly, when I came here about 9.5 years ago, I didn't realize, number one, that I was going to be dean of 3 different dental schools. Started out Medical Colleges of Georgia, then Georgia Health Sciences, and now Georgia Regents University, Augusta. And so my CV is going to look very strange when I leave here. People are going to think I couldn't keep a job. But I just want you to know that it's been my unbelievable privilege and honor to be able to have this role in this fantastic school. When I interviewed for this job, I began to look online and look at all of the things that this school was doing. And after I got here, I found out what incredible faculty, staff, and students that we had here. And I immediately nicknamed this place the hidden jewel of the South. And I think that's true because I think you heard Dr. Aziz say this, that we have a lot of great things going on here, but not everybody knew about it outside of this area. When I was interviewing to come here and I'd travel around the country, people would say, "Oh, you're going where David Pashley is." I said, "Yes." Then they'd say, "Oh, and David, as you know, is the physiology guru of the world in dental hypersensitivity." Everybody knows David. And so his brand and our brand were connected together. Same thing with Gary Whitford. Gary is the fluoride expert in the world and still remains that way today. So we have 2 Regents professors who have both won the outstanding research for lifetime of research for this school, and they're still here with us today. So that says something. And when I was preparing for this speech, for this presentation, I didn't realize until just a couple of days ago, this is our 40th anniversary, guys. Did you know that? I hadn't even paid any attention to it. So we have a lot to celebrate. And then we've had other folks come along, and I'm going to get myself in trouble by just mentioning a few. But we have the world bleaching expert right here in our midst, Dan Haywood. We have the Rod Mackert, the world's amalgam expert. We have Ulf Dickershow, one of the well-recognized people in the world for regenerative medicine. We have lots and lots and lots of unbelievable, fantastic, world-renowned faculty here. And so what we haven't done a good job of is to telling the world about how good we really are. Now, are we satisfied with where we are? Not necessarily. You can always improve, always improve. But I think we've come a long ways from the hidden jewel of the South. One of the things that we have done that I think has really enhanced our reputation and our ability to partner is our spreading out across the state to 25 different locations, sending our students out and having them provide care all over the state. Because guess what? We're the state's only dental school, right? And so our mission has to include the entire state. And I think we can be very proud of the fact that we have done an incredible job of reaching out across the state and have been able to touch a lot of lives. Now, in the last 10 years, we've also reached globally. And again, through some of our faculty here. Dr. Xu, in particular, has helped us do our first two affiliations with schools in China. Now we have France, we have Italy, we have Africa, and recently a new dental clinic in Peru. So if you think about where we were 9.5, 10 years ago, and where we are today, outside of the global presence that these gentlemen had that I already mentioned, I think we now can say that we are much more connected around the world than we ever have. And we're just getting started because our new president, I still call him new, he's been here 2 years, but our president, Dr. Aziz, is very, very keen on expanding our partnerships around the state, around the United States, and around the globe. Because we know that when you do that, that diversity, that influx of brain power and clinical skills to our school has made a huge difference. If you look at how we've been able to do all that, though, we've had very little increase in full-time faculty. We've only increased 7 total as of today over the last few years. Now, we have some empty positions, and we have a lot more part-time faculty than we used to have. But we've been able to do a lot with a smaller number of resources than you might have expected. And look at the student applicants. So why do you think that shot up so big from 163 to over 300? Well, it did that because, again, Dr. Aziz asked us to open up the doors to outside of Georgia applicants. And so when we did that, it began to increase our numbers. But we were increasing before then. But you can see now that we have a lot more people to choose from for those 80 spots that we have now. So we are able to get the best and the brightest and the most diverse group of students that you can get. When I came, they were beginning to increase the class size gradually with the goal of getting to 65. That was about the most that the dental school could hold, the old school. And so we got there a couple of years ago. And then in the meantime, we needed to grow, and we'll talk about that in a minute. So we're now up to 80 in each of the beginning classes. And you can see that we've enrolled about 75 more students now than we did in 2003, except that we will now be going up to 400 students. We're now just shy of 300. By the time we're fully enrolled, we'll be about 400. And our clinical services have increased significantly. Part of that's because of the increase in the number of students, but part of it's just because of being able to employ better business practices, to be more efficient in how we deliver our services, and also by spreading out across the state. Last year this last year, we totaled out to be almost 15,000 patient visits that our students did outside of Augusta at 25 different locations, 5,000 patients. That's a big impact on access to care in this state. And if you look at the number of patient procedures, we've almost tripled the amount of procedures that we do now compared to what we did 10 years ago. And our grants and contracts have grown. Now, not as much as we'd like, but some of our faculty, like Carol Haynes and our emeritus faculty, Jim Barney and Carol Lefebvre, have written lots of grants over the years that have supported all of this outgrowth. And we'll talk about that a little bit more in a minute. Now, when I first came, Dr. Ron had asked us to do a workforce study because we knew that this workforce, not only in dentistry, but medicine, everywhere else, was going to be of great interest. And we needed to know how many dentists do you really need in Georgia to take care of the people in the state. And what came out of that, after a very thorough one-year large panel of experts from all over the state, some of the recommendations were we needed to increase class size to 100. We needed to increase the residency size. We needed to be able to recruit and retain outstanding, diverse, talented faculty. Because at that time, we had numbers like 400 open faculty positions across the United States. We were pretty lucky here because about the most we ever had that were unfilled were 8 to 10. But that was about average across the 50-some schools at that time. And we needed to contribute more to the access to care and to oral health literacy. So let me just show you a few of the things that we've implemented over this time that are now going to take place, or are taking place. So in 2003, we had 54 students. And in 2016, we hope, by the time the new Ed Commons is built, we will be entering a class of 100 students. And of course, that depends if we're able to get the faculty and staff to support that growth. But you can see that we're well on our way to almost doubling our class size within 10 years. That's pretty ambitious. Now, we also, as we said, needed to increase the residents. And what they found when they did the workforce study was that there certainly were not nearly enough pediatric dentists in the state, and there certainly weren't enough endodontists and oral surgeons in certain sections of the state, and there weren't enough general practice resident graduates in parts of the state where they could go to that next level of care. So those were the recommendations. So after we took all this under advisement, it became obvious pretty quickly that we needed a bigger facility. And so after doing all of those studies, from our first home in the old Quonset huts there to our new beautiful school, these only held 25. This building was held to hold about 50 or 54, and our new building is built to hold 100. So we're very extraordinarily fortunate that we were able to pull this off in a time when the economy was tanking, and if it hadn't been for the support of our local commission, the City of Augusta, giving us $10 million to buy the property, and the governor at the time, Perdue, and all the other folks, Dan Ron, who helped get this piece of work on the books, this would never have happened, and we would not have been able to grow like we're growing today. So, actually, this number I checked with Darnell this morning, and Darnell and Carol Lefebvre, as you know, were integral to getting this building put together, and thank you again for that. We actually moved 690 faculty, staff, and students into this new building, $112 million building, in about July and August of last year. Now, we are a patient and family-centered care institution, right? That's the big party. That's the big party outside. And Kent's sitting here shaking his head. One of the things that we did early on is that we really bought into that patient family-centered care idea. And so we, Carol Lefebvre, who was the chair of our committee, formed this patient family center advisory group, and we included them in the planning and the development of the new school. And one of the things, I mean, they did everything from check out the dental chairs to tell us where the restrooms should be and all kinds of things. But one of the things that they also said is that they didn't want this place to look scary. They wanted it to be warm and welcoming and have things to distract them so that they wouldn't be worried about why they were in the dental school. And so we launched a campaign to have donated art from the dentist and our friends of the dental school. And we now have over 100 pieces of art, everything from wood carving to blown glass to photography to oil paintings. And you'll see that we're just now getting some of those big pieces up, but we still have lots more to go. So by the time we get to this time next year or before, we hope to have an entire gallery of art for our patients to look at while they're wandering up and down the halls in the dental school. So we think this is a way of us showing our appreciation to the patients who we serve. So thank you, all of you who did donate for the art, and we'll still take some more if you have any. One of the things that we did to address some of this access to care and the growth that we needed was to develop a new department and a new residency program. So we developed a new department of general dentistry, and we were pretty brave when we did this because not only did we develop the department, we launched that new department, which was a totally different type of curriculum, on the same day as we went electronic patient record and digital radiography. Remember that day? People in the building do, right? And we had a big celebration about like the one they're having outside because it was a big deal. And I thank everybody who was the leadership in that, and Dr. Kaufman, the other Dr. Kaufman. It's like your other brother Daryl, isn't it? He's the other Dr. Kaufman now. We're able to pull this off, and we became one of the first schools in the nation that had both electronic patient records and digital radiography all in the same time. So we were a leader in that area compared to other places. And then, as I said, we launched a new residency program, and again, to train more highly trained general dentists to go out into the state and to take care of the patients. So one of the goals that we've always had from the beginning, and which is very much in line with the university's goals, is that we've always had in the back of our mind, or the front of our mind, I should say, that we want to recruit the most diverse, talented group of faculty, staff, and students that we can, and to support the entire university, and actually the dental professions things. So guess how many people of these have come on in the last 10 years? 54 of them. So this is how many new faculty. We've had a big changeover, as you can see. 54 new faculty. But if I went around each row, you could see that we have folks from Korea, we have people from Romania, Venezuela, Israel, Japan, China, Colombia, Puerto Rico, Africa. So I'd say with Egypt, Saudi Arabia, I mean, we have really become a global-based faculty. And what does that do for us? It makes everything better. It gives us a different perspective on global health care, and it gives us the opportunity to expose our students to all kinds of cultures and practices which are really important for a dentist in the office to be able to understand. So some of our new faculty, our new chair of pediatric dentistry, Giovanni Owana. This is old retread here. We got him back after he'd been out roaming around the country doing private practice for a while. Again, one of our former faculty who came back and did perio training and came on. New faculty, new chair of perio that we were very pleased to have, Chris Cutler. Janet Swecki, who is a part-time in perio, and Yevan Kim, who is in oral rehab, and Nancy Young in general dentistry. So we're continuing to add wonderful, wonderful new faculty and staff. So how about our students? What are we doing to diversify and make sure our students are diverse? Well, if you look at just the map of where the class of 2016, so the class that just entered, where they're from, and all those little green squares show the different parts of Georgia that they're from. What you need to notice is, in all these maps, when you look at access to care, if you look at dental offices, you look at anything else, this area of Georgia is a big blank. And so we're trying very hard to get further and further down here to make sure that we train people from all over the state, because we know that the distribution of the dentists are as important as the number. And so we're trying to do our part. 10 years ago, we had about 12% of people who were from dental health professional shortage areas, which is about 2/3 of the counties in Georgia. Now we have 63%. I think I'll show you that slide in a minute. And then, as I said, we have now some students from other states, which adds to our diversity as well. If you look at our profile of our class, though, we're still way up there as far as their ability to do the work and to become really good dentists. And as you can see, even with our increase in Georgia in our class size, we still have a 4.2 to 1 ratio of applicants for everyone we accept. And here's the most important part. 51 of the 80 are from health shortage areas, 63.7%. So again, that's been a planned strategy for getting our students recruited from not only health shortage areas, but from areas all over the state. And we have a diversity of degrees before people come here. I was hoping that, is Peter Buckley here? No, I was hoping Peter would be here, because we even got one of his pre-medicine people. Ha ha. But if you look at this, we pride ourselves in trying to make our classes diverse in every way you can imagine. There's a list that long of all the colleges that they went to. I didn't put that in, but there are about 30-some colleges that our 80 students have attended. So all that diversity brings people together in a way that you wouldn't have without it. So now, why is this important? Well, one of the things that Access to Care Diversity has really pointed out to us started with this Surgeon General's report in 2000. It's the first oral health report ever. And what they found was that there were many, many underserved populations. There were many populations that were not getting access to the care they needed for lots of reasons. And so we all began to address those issues several years ago. And why? Because dental caries is still probably the #1 chronic disease in the entire world. So what we do, whether it's here in Augusta, across the state, or across the globe, is extraordinarily important. If we look at the 3rd grade data that was published a few years ago, about half of our children have caries. Now, you wouldn't think that would be true anymore with fluoride, but we still have a huge caries. And my understanding is there's new data that is just coming out that's shown that this is increasing, and it's increasing because of the of the power drinks and all those things. So 1 in 8 were not able to get dental care. So how are the other ways that we've been trying to help this access to care and this information? Well, one of the things is that we've had some of our faculty who have been very, very busy writing grants to help support our new outreach programs. And over the years, we've brought in more than $7 million in grants, some through Medicaid, some through HRSA, and some through other support areas that have helped us provide. The Medicaid grant, for instance, helps us provide about $200,000 a year in unreimbursed care for Medicaid patients who come to our school, and particularly those who need a root canal or a crown, or they have a front tooth knocked out and they need an implant. We pick up that gap of where dental insurance or Medicaid does not fill. And then our own students have given us a foundation that through all their volunteerism, they have added a tremendous amount of services across the state. Now, I'm very proud of what we have done, and what I'd like to do is just show you a little quick video that, that we produced, finished it yesterday, as a matter of fact, to show you about some of the things that we're doing outside of the things I've already mentioned. And this video is going to be submitted as part of an application for a national prize that is for service for dental schools, and it's called the William Guise Award. So cross your fingers, because we're going to submit this along with some other documents in about a week and compete at the national level for recognition of our service.
I, as a member of the dental profession, shall uphold and fulfill the following pledge and commitments. I pledge to represent the Georgia Health Sciences College of Dental Medicine by being an active role model in the communities I serve. It will be my duty to serve those who suffer from poverty, sickness, and lack of education. In humility, I shall strive to meet the needs of others, including my patients, my colleagues, and staff, before considering myself.
The mission of Georgia Health Sciences University is to lead Georgia and the world to better health through biomedical education, research, and service. I don't think it gets more explicit than that. We allow it to flourish in our students, our staff, and our faculty.
About 7 years ago, we received a grant from the American Dental Association and GlaxoSmithKline to support having a dental presence at our local Augusta Barnyard Flea Market. And you may say, oh my gosh, what are we doing there? Well, what we're doing there is screening hundreds of patients every year and giving them health care information and doing oral cancer screenings. We have also done some groundbreaking outreach to people across the southern part of Georgia. Waycross, Georgia is about 5 hours from here, and they had no pediatric dentist. We have seen over 700 patients in the last few years, and clearly 3/4 of those patients, those young children, had cavities. And of those, about 1% to 2% have to be brought up to Augusta and taken to the OR because their dental care is so far behind, and their caries are so severe that they have to be done in the OR.
We've been able to grow our clinical program with the help of AHEX, HRSA's funding, Robert Wood Johnson funding, Dental Public Health. All of those things have helped us be able to grow from one clinical site to now 25 and 13 different locations. The students have provided 5,000 patient visits, 15,000 procedures for patients all over the state. We have been able to provide 10 dentists across 2 HRSA grants, about $650,000 worth of loan forgiveness. And in return for that, those dentists have provided about $500,000 worth of patient care for indigent patients who couldn't afford it otherwise.
The Layman's Health Fair is a screening event put on by Georgia Health Sciences University in Layman Farms. This past year, probably 300 people were screened, and over 90% required a referral for one, if not two or three, dental problems. Bringing the dental students on for their screening was absolutely invaluable.
I was chosen by the dean to be the leading person into the project in Peru. So I think the students choose to go to Peru, number one, because they have a big heart and they want to give back, what they have been blessed with back to the community in countries with third world countries.
Dentists for Della is a student-run volunteer program whereby students go to Georgia War Veterans Nursing Home right here in Augusta, right near the dental school, and provide monthly oral hygiene and denture hygiene for the residents. The students gain so much from this experience, and my hope is that they'll pay it forward and they'll graduate and go and do this in nursing homes near where they practice.
One big motivation tool that I use for the faculty and staff and the students is to develop activities and different events that are fun and exciting, and where people can play games, buy food, and then the money that they spend doing that goes towards the fundraiser. So I think the most fun event we had was Dunking the Dean, where the Dean got in a dunking booth and people came and paid. Of course, she sold the most tickets for dunking, and it just shows if our Dean's willing to get in a dunking booth, then the fundraiser must be worthwhile. Also, we made calendars one year for American Heart. And the last page is our Dean, who is dressed as a queen, but it was just something fun that everybody wanted to buy one, so it wasn't difficult to sell them at all.
The Give a Smile Foundation was started in 2007 by dental students at the college who were frustrated and concerned about their patients' well-being. Many patients here weren't able to accept treatment plans because they weren't able to afford their treatment at the time. I personally think that the students are excited about this foundation because it directly affects their patients and the treatment that their patients receive.
Currently, there are 65 senior students in this class. Each student will complete 8 weeks of clinical rotations during their school year. In the class of 2012, they completed over 11,000 procedures, and they served about 5,000 or more patients. A lot of the students also talk about now wanting to volunteer or incorporate some community efforts when they become dentists. Once they graduate, they want to give back and work in the communities as well.
Anytime there's a service event, dental students, dental faculty, dental staff are first in line. They give to our community, they give throughout our university in service ways. It's truly a joy to have them as part of our university.
Thank you. You think we're going to win a prize with that? I don't know. Thank you for all those who were interviewed to help us put that together. And let's take a minute to just thank our students and the faculty who have supervised them through all these different volunteer type of things that we have. I know there are a few students in the back. Thank you, students. So these are just the pictures, again, that you saw in the video of all the areas that we were now. 10 years ago, we were at 25 sites, but they were private dental offices around the state. Now we're at 25 public health, indigent care, FQHC sites, so that our students are now being exposed and being able to help thousands of patients all over the state who truly need their help. And you heard Carol mention, Dr. Haynes mention, that we have gotten funding for student loan repayment. And as you know, student loans are skyrocketing in all the health professions. And what this has done is, remember I showed you on that slide earlier that we had almost nothing in South Georgia? This is what student loan repayment can do. It can get people to practice in the areas they're needed. And so I'm hoping as a university, I'm looking at Dr. Kaufman here, I'm hoping as a university and as a leader in the state that at some point we can really lobby for some funding or some mechanisms to where we can give more loan repayment options to students, because I think it will truly make a difference in the access to care in the state. So we've done lots of good things. We've done a lot of wonderful work in the area of scientific endeavor. We've grown our student program. From 2003, we had 1 student doing dental research. Now we have over 65. Our students, 10 or 12, present all over the world their research, and all the mentors, and I'm looking at a lot of them in the room here today, would never been able to do about that. We have a tremendous record of publications. So our faculty and our students are very visible out in the dental research world, but we need to do more. And how are we doing this with the money that we've had? Well, our state appropriations, which is what pays most of your salaries in the room here, have dwindled over the years, as you've heard Dr. Aziz say. Our state appropriations have gone up slightly over the years, but not very much. And so we have had to, 10 years ago, we were more at 70%, 65 to 70% of our budget was supported by the state. Now we've been able to lower that significantly, and next year I think you'll see it's going to be down into the upper 30s or low 40s with the trends that we're seeing now. So how have we been able to grow like we've been able to grow without having an influx of more significant state dollars? And part of that has been able to do that from our faculty practice. We have grown our faculty practice from something just less over 2 million to this year it looks like it's going to be closer to 9. So that helps underwrite some of the other programs in our school. Departmental sales, as I said, our number of patients we're treating in the school because of all the hard work of our faculty and students and staff, and thank you staff for all you do, have been part of that ability. And our grants and contracts. The Medicaid grant, for instance, pays a significant number of people in this room's salary. You may not even know it. But part of your salary, if you're treating Medicaid patients or supervising students, part of that's being picked up by these administrative grants that we've been able to get. And continuing education doesn't contribute much yet, but we've just signed a deal to where we think that we were going to begin to get more global exposure for our continuing education, because again, we have really wonderful faculty and staff here. Now, have we done on the fundraising? Well, we've kind of been a poster child for the campus for a few years, and part of that was because we were working very hard to raise money for the new school. If you look at what we've been able to do in just the last 7 years, our total that we've raised, mostly for the dental school and now for the Ed Commons, has been $12,541,000. That's pretty impressive. And what's been really impressive to me is that our very own faculty gave over $1 million of that. So thank you, faculty, for your significant faith and contributions to this school. And we're going to do more. We're just getting wound up here. And we have new infrastructure, lots of leadership in the fundraising area, so we're going to be able to do a lot more. This is what I was talking about, our growth. See, as I'm saying that we're going to be almost at 9 million this year in our faculty practice. Just from, we've gone almost 2 million since 2008. As I said, when 10 years ago it was more like 2.5 or 3 million. And we've been able to do that and still keep our expenses down thanks to our tough business office people that we have here that make sure that we're running as tight and good as we can. And again, this faculty practice underwrites a significant amount of the dental education program. Because we're a private school, we've tried very hard and we've been very successful in keeping our tuition way down compared to other schools. But we've done that because we've had our hardworking faculty who contribute back to the operation of the school and allow us to be able to offer one of the best dental educations in the world at a very reasonable price. So, how are we going to sustain our growth? Well, one of the things that we're very keen, and we're in the middle of doing a lot more recruitment on, is to increase our NIH dollars. We set some pretty lofty goals for ourselves. Back in 2003, Dr. Ron said every school will increase their research by 20% every year. And we were actually able to surpass that for a while. And then, of course, this is when the economy dumped and NIH money dried up and so forth. But even at that, we've been able to maintain a pretty steady flow of external funding coming in. But what we don't have as much of as we need is more NIH funding, because again, that brings a different level of indirects and other kinds of dollars that help support the university. So we're working very hard. We're in the middle of lots of recruitments now, so we think that's going to look a lot different. We're going to continue to work, obviously, with the university and our new university to complete the 2020 transformation. We're really going to target, once we get the money raised for this Ed Commons building, we're really going to target scholarships and endowments. The endowments mainly for endowed chairs, and particularly the scholarships for these students to help them offset their terrific loan indebtedness. And we're going to continue to reach out locally and globally. And the other new source of income, which we hope to have up and going by next year, it's been slow going, is a new ambulatory care unit in the dental school in the oral surgery area. And so we've been working very hard to get that approved so that we can now begin to have another new source of income that we've never had before. And that's being able to treat more complex patients in the OR when required. And the last couple of things, and I think you heard Dr. Kaufman talk about this the last time that she gave a presentation, that we're looking very much forward to our new collaboration and integration with Augusta State so that we can now start offering a combined DMD MBA program for our students. And we're also doing early talks about being able to do an MD degree completion program for oral maxillofacial surgery or for a true integrated program. So we're reaching out to new areas for the educational part as well. And again, as I said, we're going to continue to try to attract more and more gifted clinician scientists as we have in the past. And last but not least, we're looking very much towards Atlanta to open at some point a pediatric dentistry training residency. It's one of the biggest states biggest cities in the union that does not have a pediatric residency program. So there's a great need, and so we're working towards that goal right now. Don't know where it'll be, but we're trying to put all the plans and the accreditation documents together. So when I started out, I said we had the little tiny hidden jewel of the South. I think with all the great things that are happening both at the College of Dental Medicine and the university and our new merged university, with the leadership of Dr. Kaufman, Dr. Aziz, all of you here, and the support of our faculty, alumni, and friends, that we truly are going to be the next great American university. Thank you so much.